Hi, Dr. Vita. Welcome to the Genetic Genius podcast. I'm so excited to have you as a guest today.
Hi, Dr. Lulu. I'm so happy to talk to you again.
That's right. I know now we can just switch the roles up, right? um, Before we dive into talking about women's health, which is one of my favorite subjects to talk about, of course, and I can't wait to hear your expert tips and advice, but just let's hear a little bit about you, what your passion is, what you do on this planet makes you tick and just have fun.
Yeah, I am a mother, I am a wife, and I am all about women. So I help women work at their best. I help women maximize their talents and gifts. And so what we find is that if a woman's health is not in order, she is unable to be her very best. And so I tend to step in when women have hormonal issues or anything else that's affecting them from doing their best in life. And so
Mm.
they just call me a women's health advocate. I guess that's the best way to state what I do and who I am.
Oh, I love that, Dr. Vita, because we all need to be advocates for ourselves, but sometimes we can't step into that role. We need someone
Right.
else to help us to show our beauty, help us shine, see that power within ourselves.
Yeah, and you need somebody to walk alongside of you. A lot of what I do is motivational speaking as well. A lot of times what I've seen as women is we tend to neglect ourselves, especially once we go towards motherhood. We just completely fall off the wagon, and I'm guilty of that for a year and a half after my son was born.
Wow.
And I neglected my health. I was eating crazy. And so it took somebody really pointing it out to say, you really need to step things up. You need to take better care of yourself.
Yeah, totally. And we're as the nurturers, that easily falls off the plate.
Yes, yes.
Yes. Yeah. So self care sounds like is really key. And one of the things you advocate with women, which I love. And okay, so you specialize in women's health and being that women's health advocate. And today we're going to be talking about how to have a healthy cycle, what that means, detoxification, and fertility, one of your specialties. So let's first talk about what is a healthy cycle? I think that some people think they might have that, or what does that even mean?
So that is different for each person, contrary to what most people believe. I'm different from my sister is different from her best friend. Each person has what is called normal for them. So
Mm.
if you present yourself with a 29-day cycle, you don't have clots in there, you are symptom free, that's great. Then I'm going to say, yes, you have a great cycle. If you present yourself with a 32-day cycle and you don't have the extra clots, you don't have painful periods, then I'm going to say, good job. So the actual length of time, it depends for each person. Concerned if you're maybe at 23 days or 24, 25 days. And I'm also going to be concerned if you're more towards the 35, 36, 37 day mark. But generally, what I say is it should be as symptom free as possible.
Mm.
And you also shouldn't have big chunks of tissue coming out. That's letting us know that there's something serious going on. And also the clots that come out with that. I try to say, have as few clots as possible.
Yeah. And what about the color of the blood? Is that an important aspect of the bleeding as well?
That's a very important aspect of the bleeding. So it should be bright red. If you start to see brownish, of course, that's a little bit of older blood, which is okay to see in the very beginning, just because you may have a little spotting in the beginning, maybe a little spotting at the end. But overall, we should see bright red blood.
Mm. Hmm. Yeah, that's really important to know because some people don't understand that those aspects of the different parts during the days. Right? I like how you mentioned that beginning of the bleeding. And then also, is there a particular amount of days you're looking for a healthy cycle with bleeding?
I I've actually been able to change that with women. So a woman is just about to get pregnant. I really like that, like 3 days of the bleeding, red bleeding. 5 should be the maximum. So I aim somewhere between that 3 to 4 days. 5 days I'm okay with. Now, if a woman's bleeding 7 days, I don't see women like that having good blood work. Usually when we do blood work, we start to see issues popping up
Right.
when a woman is bleeding for 7 days or more.
Yeah.
So I like 3 to 5, and that's something that can be changed. I was able to change the amount of time that I bleed. So that's definitely something that when I'm working with a woman who's about to get pregnant, we change that as well.
Right. Because you can go into signs of anemia, correct? If you're having
Right.
really long days of bleeding, which is not a good place to be if you're trying to conceive. You want to have
I
healthy red
almost
blood cells.
always see anemia.
Yeah.
Yep, I almost always see anemia in women that bleed for more than 5 days.
Yeah. And they're feeling tired. The last thing you do is want to have sex and conceive if you're feeling tired.
Yeah. Yeah.
Okay, so we're looking for that healthy cycle. And then do you have like a favorite tracker? I have patients ask me all the time, what's the best way to track my cycle? Do I need to be tracking like the emotional component as well as the physical? Are both of those as important?
I have been tracking my cycle for maybe 15 years or so. It's something that I love doing. I'm just like so into tracking it. I love to track when I have intercourse. Like I track everything. But that's my personality and I enjoy that. For women that aren't into that, I love graphs, I love charts, I love all of that. If you're not into that, then I say if there's no problem, if you don't feel like there's a problem, you don't have to do anything that is going to put additional stress on you.
Right.
Now, if you want to have a baby and you've been trying to have a baby, then you absolutely have to do it. If you're having any kind of issues, if you're missing cycles, if there's a problem, then yes, absolutely. But there's some women that are just healthy and they hate tracking. So I don't tend to push that. So if you're okay with tracking, I say yes, absolutely. You can also see health issues from looking at your charts. But if
Mhm.
you hate it, don't force yourself to do something you hate doing.
Right. Yeah, that never works with patients. They're not going to be compliant. But I love that you said if you're working with fertility, trying to get pregnant, it's important to track your cycles because you want to know, like you said, what's that time period of fertility? You didn't mention, but when is that main time period where they're going to be trying to get pregnant that they're going to be tracking?
I tell women start tracking 6 months before.
Mm,
So 6 months before, understand and make sure that everything's okay. Check your weight, make sure everything's okay with your body, look at your skin. Is everything clear? See, I'm wearing no makeup. So assess your skin, see how things are looking there. Just do an overall total body check six
right.
months before you want to get pregnant. And then
Yeah.
I would say start tracking for a couple months. It takes a
Hmm.
few months to really see, okay, I'm consistently having periods that are 28 days long or 29 days long. So it takes a while and you need some time to gather that data. You need
Right.
at least 3 months to really see if you have consistent flow. We say in statistics, you need at least three.
And if they're, say they're tracking and then there comes to be this point in time where they're wondering why they're not getting pregnant. What are those signs that they are like to identify with tracking? Like, oh yeah, you mentioned some of that days. Is there some other things that they should be looking for with tracking that might be a red flag, so to speak, or signs as a problem of conceiving?
Yeah, so everybody's different. Like I
Mm.
said, I know a woman who had 35, 36-day cycles that were relatively irregular, and she was able to conceive with no problems.
Hmm.
Of course, she ended up having hormonal hell after that baby, which is
Right.
why I will fix these issues. But she was able to get pregnant. I would say consistency tells us a lot. If you're
Mm.
consistent, it doesn't have to be right down to the day, but if you're usually around a certain range of a day or two, that's great. And
Hmm.
if you're spot on like every single day, then that's perfect. But if you're seeing that you're going like 1 month, 28 days, then another month you're 35, then we need to figure out what's going on there. And then also we need to see what's going on in the middle of your cycle. So not
Hmm.
everybody ovulates in the middle of the cycle, but when I track, I ask women to keep track of their symptoms, to keep track of the cervical mucus that's coming out, because that tells us when you're fertile. So
Right.
we need a couple months to see, okay, are you having that cervical mucus coming out in the middle of your cycle, or are you not having any coming out?
Hmm.
So when we say tracking our cycle, it's not just necessarily talking about when you actually have the flow, but what's
Right.
going on at other times. When are you breaking out? If you break out, are you having tender breasts? All of that. So we need to look at the entire cycle as a whole. So
Mm-hmm.
back to your question, if a woman is trying to get pregnant, when you know that there's a problem is number one, inconsistency. Number two, maybe you're not noticing any of the cervical mucus coming out, or you're sticking your finger there, you're not feeling that egg white cervical mucus in the middle, or you're starting to get an exacerbation of symptoms before your period. That lets us know something, or extremely painful periods could also let us know there's a problem as
Right. Oh, that's great, Dr. Vita, because there, as women, we can be a little bit complicated when it comes to our cycles. So I love that you said consistency is key. And if we're trying to conceive, we want to have that
yes,
consistency for sure. Yeah. Um,
absolutely.
Love it. Love it. So what do you see as like the three most common underlying like root causes of infertility? If you're looking at in general, like you said, everybody's different, but are there three main things that you've been seeing in your practice that are like, oh yeah, these things are coming up consistently with patients?
Number one, weight.
Mm,
Weight is a big thing. I can tell you that maybe about 90% of the women that are having fertility issues have weight problems as
hmm.
well.
Wow, that's so
So
interesting.
absolutely, yeah, most of the women that come across my path, especially the ones that have been trying to get pregnant maybe for years,
Mm,
weight is a major thing that's coming up. Number two is they don't eat. A lot of them will maybe eat one meal a day, two meals a day, but when they do eat, it's just like binging on crap. So
mm,
I would say what the food that they eat is definitely number two. Number three, I have noticed, Dr. Lulu, that the women that have been trying to conceive for the longest, and a lot of my PCOS women, they wear a lot of makeup every day.
mm.
And a lot of people don't point that out, but I have seen I'll have these beauty bloggers that have these YouTube channels and their job is just putting on this makeup. A lot of them, I work with them because they're now
Mm-hmm.
struggling to have children. So those are just three patterns that I've seen that are very, very common in my women that, especially that have been trying to get pregnant for a long time.
So interesting. I love the aspect of the makeup because there a lot of women aren't aware one of the toxicity of makeup, and then also just like applying so much into your skin all the time, right? Our skin's our
Right.
biggest organ. We're absorbing straight into our body, and that can contribute a lot to the stress of the body having to deal with those toxins on an everyday basis.
Yeah, and the way that it's layered. So they start off with a primer that's crap, and then you start going to one layer of this concealer. Then we have this stuff under the eyes, and then we're moving into like different layers over here. Then we're highlighting, then we're doing all this stuff around the eyes. And look, I'm okay with makeup. I'm not saying that I dislike makeup. I
Right.
tend to stick more with the non-toxic brands, but
Yes.
even hey, I wear MAC makeup every once in a while. Their makeup is looks great, but every single day is definitely I see that that's affecting the women that I work with.
Yeah, totally. I can totally understand that, which is a great, like, kind of like segue into talking about detoxification. So, those three things that you just mentioned, are those part of detoxification? And why is it so important for to have that detoxification in order to conceive or be fertile?
So what we see with a lot of diseases, illnesses, conditions, and fertility is a serious condition. If you're infertile, that is absolutely a condition. What we're seeing is this is your body is not functioning well. Your body's not functioning at its prime. And a lot of times what that boils down to in women's health is you have a hormonal issue. So I'll look at your blood work, there's some kind of hormonal issue. Sometimes it's not the main ones like luteinizing hormone, follicle stimulating hormone, estrogen, progesterone. But
Right.
somewhere down the line, if we do a full hormonal panel, we'll see a problem there. Maybe it could be a
Exactly.
thyroid or something like that. And so essentially, we have to now think of the organs that could be contributing to that. For women's health, we have to go to the liver. Hormones, we have to look at the queen. I call her the queen. The liver
The
is the
liver
queen
queen.
of processing these hormones. And so I absolutely will take a woman through a regimen where we are just kind of detoxifying, mainly using the liver. Of course, we'll do some skin detoxification as well. That is amazing,
Mm.
especially with my beauty bloggers and those types of women. Um, but we essentially need to go through a process where we are unclogging some pipes in your body and
Mhm.
allowing your body to process your hormones naturally again.
Right. Yeah, that totally makes sense. And I love that you call the liver the queen, which is so true. Some people don't even think about the liver when it comes to women's health. And then when we talk about it, the organ to patients are like, what does the liver
Right.
do? And it's so key, so important. And when you're doing detoxification, you mentioned detoxifying the liver and detoxifying the skin, that other biggest organ. Is there a program that you like usually use to walk patients through with infertility problems or fertility optimization?
Absolutely. So I will work with a woman one-on-one. Some women will come and their situation is a little bit easier. So we're able to say, okay, take this. And then, okay, she's ovulating fine, everything's okay.
Right.
But some of the women that have more serious hormonal issues, we're saying PCOS, maybe there is very low progesterone, things like that. I do have certain systems and detoxes that I'll put a woman through. Typically, what I like to do though is do that in conjunction with weight loss. If a
Mm,
woman is overweight, if she's
right.
not overweight, then that's great. We can detox the skin and the liver. But yes, I do have programs available that I will walk women through, mostly on a one-on-one basis,
Mm,
because every woman is unique, especially
right.
when we're talking about this woman's health thing. Everybody has a unique cycle and all that other stuff. So yes, I do work one-on-one with women.
Nice. That's great. Yeah. And I love that you said, Dr. Vita, that individualized, so key because we all have our individual cycles and problems. I wouldn't say problems is not a good word, different aspects of our life through those hormonal balances, right? The like puberty, menopause, pregnancy, all of it. It's like different change in our hormones where we have a shift as a woman.
Yeah, and you talk a lot about DNA. At the end of the day, that this is the Genetic Genius podcast.
That's
So
right.
at the
Yeah.
end of the day, it has to be something that's suited to you, your family history. You talk a lot about epigenetics and just your environmental factors. Where do you live? What do you do
Right.
every day? So that's a big fact. One woman that has PCOS is different from the next.
Yeah, totally. You're right. It's so about the DNA, Dr. Vita, because it's true how our cells are functioning, that cellular makeup, the actual like reproductive cells. Are they doing their job in there? How's the DNA of the reproductive cells? If they're tired out and worn out, they're not going to be wanting to have reproduce. Yeah. When you're working with the liver, of course, you just mentioned liver. So, of course, I got to ask a question about the liver. What are your favorite like detoxifying herbs? Because I know you love herbs.
Oh my goodness, this is different. I like milk thistle.
Hmm.
Milk thistle is a good one. I like burdock
Mm,
root is wonderful, especially for my women that have PCOS. I'm talking a lot about PCOS today. I work with women who have a lot of other stuff, but today PCOS is just my
it's all
PCOS
good.
women on my mind today.
It's all
I would
good.
say milk thistle, burdock root. I would say those are my two favorite.
Yeah.
I'm really digging these with the specific group of women that I've been working with the past 6 months or so.
Yeah, I love both of those, especially the burdock root for clearing the skin. You're mentioning, and the liver and the skin are so connected. And burdock is great too, because you can add it to soups or a salad, you can pickle it. And so it adds some variety for people that don't always want to take tinctures or capsules or
Right.
anything like that. And
Yes.
I like the way it tastes as a tea too, not milk thistle tea as much, but burdock is like sweet. Awesome. When you're talking about working with that detoxification piece, and are you also working like, what's your kind of like goal with that? The goal is to have the cycles consistent when you're working for the detoxification, or is it more like is there something like an end goal you're looking for?
My end goal is blood work
Mhm.
when we're detoxifying. We don't detoxify for a long time, but I definitely want to see improvements in blood work within a matter of weeks. If
Mhm.
I start to see that there's improvement at the end of a detox, then we stop the protocol that I have. We continue with certain herbs, but then we go back to more lifestyle. We slowly phase back into their usual lifestyle. Not usual, but what they're generally going to continue.
Their new lifestyle. Especially like you said, if they've been haven't been eating well. So that sounds like a part of your nutritional plan or how you're working individually with patients. What does that look like? Are there specific foods that you're looking at in regards to fertility that can help optimize that fertility?
A big thing that we are noting that's controversial is dairy. And so there is evidence out there that suggests for my women that don't ovulate, when we give full fat yogurt, full fat dairy, they do well with. A lot of them maybe have been used to 2%. The process that this 2%, 1% skim milk undergoes isn't great for it produces enzymes that spike our blood sugar, and so that causes a problem for fertility. And so one of the things that I ask women to incorporate more of are healthy fats. And with that said, Dan and plain yogurt, full milk, whole milk is definitely a part of that regimen. So for example, I'll ask a woman to make that yogurt, add a little maca in there, add a few other things to boost fertility. And then that's one of the staples that I'll ask a woman to have as often as they can. So usually every day they'll have that. So it's mostly increasing those healthy fats. That's a big component. Of course, we remove a lot of food. I think it's mostly an elimination situation.
Right.
I give them everything, but for the most part, it's really eliminating a lot of the foods that they're used to eating.
Yeah, that makes total sense because as women, we need to have that fat to have our liver, which we keep going back to the liver, to make good cholesterol. And if we don't have that good cholesterol, we're not going to make good hormones. We're going to make crappy hormones. Or get a hormone imbalance.
And a precursor to estrogen, a lot of these hormones is fat. So if you don't have enough of that fat, enough of those lipids, then you're not going to make the proper amounts of hormones. And then another hormone will start compensating. Then before you know it, you have an increase in testosterone and it causes a disaster.
Yeah, hormone disaster, totally. You mentioned the weight component. What about the other side of the scale? Women who are very thin, exercise a lot. Are you seeing some of those types of patients also come in with fertility problems or fertility optimization problems?
I've never had somebody who exercised a lot. I've never worked with somebody who exercised a lot. And I exercise 4 to 5 days a week, but I've never had and I was an athlete in college. I've never had anybody that was a bodybuilder or anything like that.
That's interesting.
Underweight, I've definitely worked with women who are underweight. A lot of times it seems like they have more damage than the women that are overweight.
Yeah.
They're just have so many nutritional deficiencies. It takes a long time. It takes me longer to work with a woman that's underweight. Yes, they have serious issues usually.
Yeah.
And then
Yeah.
we also have to look at the reason for why they're underweight. Usually there's something serious, whether that's psychologically or just their health, their thyroid or something else.
Yeah, totally. It made me think about something I wanted to go back to. We were talking about at the beginning, the emotional component with like cycle tracking, but how about the emotional component in relationship to fertility? Is that something you see a lot that you're needing to work with patients, whether you're doing it yourself or referring them out for psychological help or counseling?
Yes, that's a big part of what I do. Almost everybody that I've worked with, and really probably almost everybody in the world, but specifically the ones that have fertility issues, they have a lot of childhood issues. Especially, I can tie my women who have endometriosis. Almost all of them have been raped. Of all the women that I've worked with that have endometriosis, so I notice patterns like that of women that have these issues. Usually, something traumatic that happened to them.
Mhm.
when they were younger. And so we have to address that. In the
Right.
very, very beginning, when I first talk to somebody and I want to work on them, I tell them, hey, this is a different kind of situation that we're going to go through. I'm not just going to give you something and tell you to go take this 3 times a day. We're really trying to get to the root of the problem. And then if I see that it's something where the person needs therapy, a psychiatrist or a
Right.
psychologist, then I'll definitely refer them out. But some women, they benefit from conversations with me. I have exercises for them to do. I'll maybe do about 4 sessions, specifically focusing on the mental aspect
Yeah.
throughout their journey.
So important. And what about that stress component? So we have that emotional trauma piece. What about stress? Are you seeing that be a huge piece of infertility?
Yeah, so everybody that I work with is stressed because, they have this pressure, they're not getting pregnant. A lot of them, this is causing friction in their relationships. So every single person that I deal with stress. And so a lot of what I'm doing is helping them de-stress, setting guidelines, setting boundaries, things like that.
Yeah, so important. And especially like you mentioned in the beginning, that self-care piece, we know as women, we give, but, and they haven't even
Yeah.
had the baby yet, or maybe they are trying for their second one, but that self-nurturing is so important. And you're not going to be able to conceive and be fertile if you're stressed. Your body's like, no, this is not going to
Yeah,
happen.
our bodies are smart. Like even without us thinking consciously, they know they want to protect themselves and then also that baby. So if you're stressed, it knows I cannot manage this baby. I cannot manage the stress. And so a
Mhm.
lot of times that miscarriages are the result of that. Your body's signaling, I don't think I can do this for the next 10 months or so. So yeah, I I that's a big component is just de-stressing from the issues of fertility, but I also work with a lot of nurses as well. So their schedules are crazy. I mean, some of them, it's just out of this world. And
Yeah.
we have to address that. That's something we have to address as well. We have to address sleep. You have to address a lot of things.
Yeah, totally. Yeah, you just mentioned sleep. How important is sleep and like that? Let How about the foundations? Let's talk about. So you talked about nutrition. What are some of those main like 4 or 5 foundations that have to be addressed in the aspect of fertility?
Yeah, well, for sleep, sleep will tell me a lot about you. So if you tell me what time you go to sleep, whether it's easy for you to fall asleep, how much you wake up at night, that tells me if you're constantly waking up to pee, that tells me issue that there's definitely issues there, what time you wake up. So yes, sleep quality is big. Now, if we're dealing with insomnia or some other sleep issues, sleep apnea, then that's something that we have to address medically.
Right.
But then there's also just state of mind or
Mm,
unhealthy habits. I have a bedtime for the people that I work with. If you're going to sleep at 1 a.m., 2 a.m., and then it doesn't serve you and you have to wake up and go to work at 8 a.m. So we have to
right.
address some of those things.
Yeah.
So definitely food, sleep. I would say drinking, and I talk about this a whole lot.
Talk about alcohol.
Not drinking alcohol specifically, but just whatever you consume. Yes, food is important. We need to pay attention to that. But I find that what we're drinking makes a big difference as well. And
Mhm.
so people tend to go towards those sugary drinks. People towards tend to go even those carbonated diet drinks and different things like that, or the lack of drinking. So the whole ovulation process depends on fluids. It depends on water.
Right. Yeah.
So you need to be hydrated. So definitely drink consumption, and this isn't just water. Actually, I have them drinking herbs most of the time. The process. So I have them infuse herbs and do different things like that. So I would say that's number 3. Number 4 is making sure they have proper supplementation.
Hmm.
And so this isn't going to Walmart and getting those terrible multivitamins that they sell there, but
Right.
actually making sure that you're consuming natural vitamins for you. And so we get that in herbs and we get that through nature, but we know that in our soil, we're not getting enough nutrients from our soil. And you know all about that with your background. And so proper supplementation from nature is important. And so that's tracking what they eat over a certain period of time, and then really trying to calculate, okay, this is the percentage of vitamin that you're getting overall. And so we need to work on that. So
Right.
usually we see that a lot of these women are nutrition deficient, find strategies for them to get proper supplementation, but also supplementation that's natural, not from a chemical source.
Do you do a nutrient panel? Is that something you usually
Yeah.
run from the lab
So,
work?
so I don't do that every time. Just sometimes financial reasons,
Right. It gets
insurance reasons, things
expensive.
like that. Yeah, yeah. So I don't necessarily do that every time, but if it gets serious, we do end up. If I feel like it's warranted, then
Hmm.
we can. And then I would say the last thing is just what beauty, what they're putting on their
Mm,
skin.
right.
That's a very important factor that we need to pay attention to. So those are the five
Hmm.
main areas that I look at.
I love that. That's great because those are the key things that you're looking at. And you mentioned that detoxification piece, making sure all those components are running smoothly.
Yes,
Yeah.
absolutely. And so those things, if they're out of, so let's go back to sleep. So of course, sleep depends on hormones. Feeling tired at night, all of that, that's all regulated by hormones, how deep you get into your cycles. And so if you are unable to fall asleep, then that's telling us, okay, well, that's a hormone that's not working there. All of this, it's just it how your lifestyle is in these five key areas will tell us your hormonal state and what type of detox and how long of a detox they need to do.
I love that. And so important because, like you said, everybody's individualized. So when we look at those foundations within the individual of the patient, okay, all of those foundations are out of balance. There's definitely some hormonal issues that are most likely out of balance, and you need a deeper detox.
And there's some women that come to me and it's easy. And it's so easy. Their situation is easy. But what I'm mostly talking about are those women that are more towards serious issues going on.
Right.
Some
Yeah.
things are easy fixes.
Yeah, totally. Right. Not everybody's the difficult case.
Right, right.
Yeah,
Yeah.
which we love the difficult cases as much as the easy ones. We love them all,
Yeah.
right? Yeah.
We love them
We love
all.
them all.
Come all, come all.
That's right. So we talked about some of your favorite herbs for detoxification. And with fertility, what are your top like fertility boosters? Like for our listeners that are like tuning in now, hey, I'm looking to help boost my fertility. What can I do, Dr. Vita?
Red clover, 100%. Red clover is my favorite. A little bit more expensive. Make sure you're getting the blossom that's
Mm,
dried and organic. I get organic for for red clover. Red raspberry leaf is also a really good one, especially if you're actually in the process of conceiving and you're at that what we call the 2-week wait. The red raspberry leaf, also blackberry leaf, also in there. They help to really thicken that lining that you have, so that it helps with implantation. I would say a third one that I really like, I would say oat straw for the
mm,
ladies that have issues with the cervical mucus. Really good for that as well. So around the middle of the cycle, oat straw is amazing. Red clover throughout the entire cycle. Red raspberry leaf, I wouldn't take as much of it in the middle of the cycle, maybe after
mhm,
ovulation. And
mm.
then of course I'm going to throw maca root in there. Maca root
Right. I love maca.
powder.
Yeah.
Yeah.
And Avena, oh, I love those. Yeah. So red raspberry leaf and red clover. You mentioned oat straw and also maca. Great ones. And those are all really one. I love oat straw, Avena sativa, that milky oats, because it also is
Mhm.
that nervine, right? And so it's helping women who
Yeah.
are that stress component, especially like, oh my gosh, am I going to conceive in the middle of the month? It helps them
Yes.
relax.
Yes. And it tastes amazing.
Yeah, so good, so tasty. Oh, wonderful, Dr. Vita. As we're wrapping up today, I'd love for you to talk about your book and how people can find it. So it's the Women's Health Guide, 5 minutes a day to boost energy, balance hormones, and live a better life. Talk about what's that book about? I mean, besides the title.
So I have a lot of women that reached out to me and they're just like, hey, I'm busy. I don't have time for like a long program. I don't have time for these sessions, and I don't have time to make complicated recipes. And I don't have time for big, long, exacerbated process. But I want just like small changes that I can make. Or maybe I'm a mother, I'm a career woman, I'm a student. And so I came up with this as a guide. And so these are just things that a woman can do for 5 minutes each day that help with their hormonal system. So you can do 10 things and spend 10 times 5 minutes a day. Of course, you'll see faster results. Or you can just spend 5 minutes a week and then you just do this thing and then make it a habit and then you move forward. So these are just bite-sized chunks, little things that you can do to just really get back to yourself, balance those hormones.
That's great. And what are some examples of those things that are in the book that you can take 5 minutes a day to do?
Okay, yeah. So for example, I talk about juicing, how
Mm,
you can just grab your vegetables and juice, and that makes a big difference. Instead of
really.
having a sugary drink, that's something that you can make in less than 5 minutes, depending on your juicer. But if you have a good quality juicer, that's something that's quick, easy, simple. Also talk about exercise. If you don't have a
Mhm.
lot of time to exercise, there are things that you can do. And at the end of 5 minutes, you will be dying.
I love that. Yeah. You get super intense.
I also talk about making your own cleaning products, for example. And I also share recipes in there. You can make this cleaning product instead of using that really harsh tub cleaner. But here's a cleaner you can make in less than 5 minutes and it's safe. It cleans really well, but it's not toxic for your kids. It's not toxic for you. If you're going to get in that bathtub or step on that shower, you're absorbing those chemicals. So these are just little simple things. You just make these quick fixes over a long period of time. You'll see that you'll feel better.
Oh, I love it. Great. And how can people find it? Where can they purchase the book?
So you can purchase the book on Amazon. You can get the ebook, you can get the hard copy. Also, it's on audible.com. I see that people love the audiobook. So most people will grab the audiobook on audible.com, but if you go on Amazon, you'll find it there.
Oh, nice. Great. Okay, Dr. Vita, one last question before we wrap up. If you had an unlimited budget right now, what would you do with that money to make the biggest impact on the planet?
I would have an herb farm. I would
Woohoo!
just grow all of the herbs there. And you don't even need like a big giant space. I actually have a farm and I'm planning to do this. But so I would just grow a bunch of herbs and invite you all to come and get them.
Awesome. You got to come visit my herb farm.
I will. Where's
Yeah.
the invite?
Yeah, I know. I'm sorry I haven't extended it to you, but I will. Yeah, come to Asheville and visit and I'll take you to the farm. And when it's has herbs, you got to come in the summer.
And I'm from the Raleigh Durham area, so I will be there.
Yeah, come anytime. We'd love to have you. Okay, Dr. Vita, how can people find you? What's your website? Follow you? And if they want to book a one-on-one session, how can they do that?
Sure. You can go to info@drvita.com and somebody from my team will be with you. The next best is for you to go on my YouTube. So it's Dr. Vita Natural Health. And then if you go on there, you'll see lots of good links on my YouTube. And then you can also go on TikTok, Instagram, all of those at Dr. Vita K as well. And
Great.
Facebook as
Easy. You're all over the place.
well.
Awesome. Thank you so much, Dr. Vita. It's been a joy to have you on the show today. And I learned so much about women's health and infertility.
Great. Always a pleasure, Dr. Lulu.
Thank you so much.